The word ketosis has gained quite a bit of popularity in recent years due to keto diets. But what does ketosis really mean? Hello, I'm Dr. Patel, and I get asked this question quite often, so I'm happy to answer it here today. Nutritional ketosis is when your body uses fat as a fuel rather than carbohydrates or glucose. This is a great way to do fat burning. So how does one get into the state of ketosis? To understand this, let's talk about glucose first. Your body normally uses glucose for day-to-day energy or fuel. For instance, say you eat a piece of bread, which is mostly carbs. Now, when this bread is digested, it is broken down into small glucose molecules, which are used by all of your individual cells in the body for energy. So if you regularly eat carbs day to day, you supply your cells with all the fuel you needed in the form of glucose. Now let's change that scenario. What if you significantly reduce the carbs and replace them with proteins and good fats? Now your body does not have the carbs for day-to-day fuel. Where does it turn to for energy? Well, it uses up the glucose that is stored in your liver first. When this is used up in a couple of days, your body then turns to fat for its fuel. In fact, fat is a wonderful energy source for your cells. Unfortunately, you may not give your body a chance to use fat for energy, especially if you provide it with a constant supply of carbohydrates each day. So now you understand what ketosis is. When you burn fat, your body makes something called ketones, which is the fuel your body uses. But is ketosis a good or a bad thing? And what are the benefits of ketosis? The ketogenic diet was originally developed to treat children with epilepsy. But it is also known that a ketogenic diet can help you lose weight and make you feel less hungry. It also helps to keep your muscle mass intact. Ketosis usually kicks in 3 to 4 days after eating less than 50 grams of carbs per day. Studies show that ketogenic diets can lower your risk of heart disease, type 2 diabetes, and insulin resistance. During the first week of a keto eating plan, you may feel some temporary side effects such as headache, fatigue, brain fog, irritability, constipation, and even some trouble sleeping. So how do you know that you're in ketosis? It can be checked in 3 ways: via blood, breath, or urine. Blood testing is the most accurate, but urine testing is easier. Breath testing is also an option, but it isn't as accurate. For most people, when checking the urine for ketones, a light to optimal level of ketosis is fine for weight loss purposes. And one final thing, don't confuse ketosis and ketoacidosis. While ketosis is a safe method for fat burning, ketoacidosis is when the body produces a dangerous amount of ketones, often seen as a complication in type 1 diabetes. So whether you're interested in losing weight or looking for some health benefits, a ketogenic eating plan may be beneficial for you, especially when done correctly and under expert guidance. If you're looking for such expert guidance, my team and I are here for you. To get started or learn more, go to healthymeweightloss.com. We are excited to meet you and help you achieve your weight loss and health goals.